Hi, I'm Bill Patten, Interim CEO at Sublette County Health, and I'm here giving you a report on the board meeting that was held on March 25th. Today I'm coming to you from one of our newly remodeled rooms in the Sublette Center, rooms that we are turning into a dormitory. So a little bit more casual than some of the past videos that we've done. We'd like to show you what we've created so that we can have some space to house our traveling employees, for folks that need space for 2 or 3 months. So that rather than letting the Sublette Center sit here and gather dust, we're going to have 8 rooms that are devoted on the women's side and 4 rooms on the men's side. We plan to have these rooms available starting second week in April. And then down the north hall of the Sublette Center, we've moved a lot of the offices from the hospital campus down here to make room for additional clinic, exam rooms, and physician offices. To the board report. So the board started the meeting by reviewing minutes from the last few board meetings, including executive sessions. There was no public comment. The building committee reported that they have one more pay application that they need to make to Layton, and then that should be closed, and they're working with the USDA to get that loan finalized. We need to get that done no later than June the 30th as it relates to our construction bonds. The Health Foundation gave a report. Carrie DeWitt reported on the funds that the foundation currently has, how much it has paid toward the hospital project. Also talked about 3 specific projects that the foundation board had approved that we needed the hospital board to approve. One was for extending the nurse call system into our clinics. Another was funding a ultrasound machine, a bladder scanner for the Heritage Home, and the third request related to redoing the locks on 2 rooms. We call them our seclusion rooms, the hold rooms for psychiatric type patients. So the board was thankful for the foundation's support and approved all 3 of those requests. Foundation also talked about plans that it has for events coming up this summer and thoughts about doing some of the events here on the Sublette Center campus. So look for more information on that in coming reports. Dr. Burnett gave a report from the provider perspective. He shared some statistics with the board related to the volumes that each of the providers have had over the last several quarters, and talked about volumes within our urgent care. In my report, I had talked about recruitment that we're doing for the urgent care and different options we're looking at as far as adjusting the schedules so that we can make sure that we have good urgent care coverage, but we're also having positions that urgent care providers want to be recruited into. The operations report for departments like the laboratory and radiology, there was no additional comments for those. Mark Armstrong was here from Health Tech and gave an update on a lot of the support work that Health Tech is doing for our organization. One of the things is they're helping us convert to a new general purchasing organization. We're seeing significant reductions in our costs as a result of that. In some areas, 20 to 30% reduction over what we had been paying. Mark also talked about the support that Health Tech is giving us as it relates to our efforts to collect old bills, both from our old computer system and from the new computer system. I'll go into my report in just a minute. The board approved the normal payroll and bills list. We reviewed a contract with 307 Air Rescue. 307 is a company that's being brought together to provide helicopter transport services, medical transport. And they had proposed having their helicopter stationed on our helipad at the hospital for no cost. So we had negotiated a contract with them. Our team, EMS, ED docs, had been actively involved in the negotiations. So we were able to present a final contract to the board last night. The only expense that we will see is we're going to share the cost of putting up a fence around the helipad to provide better protection. And then we're gonna buy a little bit of helipad insurance, just because we'll have additional exposure there. But the board unanimously ratified that. So in the coming months, you'll see a helicopter permanently stationed, except for bad weather or when they're out on a transport. This is really good news for our patients because they're gonna have a much quicker turnaround time whenever we do need to fly someone out. Also, it's good news for the community because there are gonna be 6 to 8 full-time new jobs created here in our community. The pilots, a mechanic, the flight nurses. So this is a win-win at no cost. So if you hear rumors about what's the hospital doing, buying a helicopter, you can tell them you heard it straight from the horse's mouth. We're not spending money on a helicopter, but we're gonna have all the benefits of having one here on our campus. So that was very good news. And then the board reviewed updates on physician contracts. As we've been working through a number of new contracts for new providers, we've noticed that there were several inconsistencies either between current policy or wording in different contracts. So there were 5 different elements, all non-compensation elements, that we needed to standardize to bring the contracts both into uniformity but to be compliant with current laws and regulations. So the board went through and reviewed the updates to the contracts. All of those were approved, and so I've sent the contract amendments out to the medical staff so that we can make sure that we have a little bit more uniformity as it relates to how we deal with our medical staff. As it relates to my report, I thanked everyone who was able to be part of this project at the Sublette Center, both remodeling the dorms, but also we held our first meeting last night in the Howard Smith conference room. It used to be the Howard Smith dining room, it's now the Howard Smith conference room. We took the big cafeteria and converted it into a very nice conference room. And so that's where we're gonna hold our board meetings more and more in Pinedale from now on. We'll be able to do training sessions in there. Comfortably seats a group of anywhere from 30 to 50 people. So we thank Tyler and his group, Kevin and Tammy, Gentry and Marcus. We thank the IT team that made all of the technology possible in the room, Brett and Matt. And then my assistant Jan, she was the contract manager on the whole project. But it was a really nice room, and now we have our own meeting room. We're thankful that the county commissioners have allowed us to use their space for these past years, but now we have a room here on our own campus. We will continue to alternate going down to Marbleton using the town hall for those. So I was very appreciative of those people. We introduced our new HR director, Raymond May. He was at the meeting last night. Very glad to have him on board. We talked about the policies that will be coming before the board. So there are 6 policies that will be going to the board. We also have made a change from the way it was when I first got here. Not all policies go to the board anymore, and so I informed the board about another 6 policies that the senior leadership team has updated or is working to update. We are celebrating National Doctors Day next Monday, and we're going to be including all of our providers, so the MDs, DOs, nurse practitioners, and PAs. We rely on our entire team, so we're going to be saying a nice thank you. If you're in the hospital, look for the special recognition signs we'll be making for the medical staff. We have a strong family medicine candidate that the medical staff has interviewed, and we've presented with a contract offer. This is part of our effort to add 4 new family medicine docs to our clinic team. They would provide coverage for our hospital and also expand our capacity in the clinic. We are looking at 2 different options as it relates to our women's health program. As I announced last month, Raleigh Perry is leaving us. She's moving her family back to Idaho. So we are diligently working to make sure that there's not much of a gap. We've identified one possibility for a part-time women's health provider to bridge the gap while we're looking for a permanent, and we're interviewing a doctorate of nurse practitioner candidate for Women's Health who also would have experience in some of the special areas that Raleigh provides, things like hormone therapy. So we'll keep you posted on that. We're also talking with a couple of family medicine residents about the possibility of joining our program. They are excited to have a program where they're able to practice in the clinic, practice in the hospital, and practice in a nursing home. So just the sort of docs we're looking for. As I say, we want to hire a total of 4. We've got 3 that are nibbling at the hook now, so we're hopeful we can move forward with them soon. And I think I mentioned this last time, but we've adjusted the hours in our urgent care. We were 10 to 6. Based on comments we've received from our patients, we're moving it 9 to 5, and we're recruiting for another urgent care provider. We're looking at possibly changing their schedules to make that a more attractive recruitment. We received a $5,000 grant from Rocky Mountain Power. That was for purchase of some of the workstation on wheels, computers, portable workstations that our nurses use in med-surg and in ED. We received $2,000 from Jonah Energy to help support some of our recognitions that we do during like National Nurses Week or National Laboratory Week. So $2,000, we appreciated that donation. We are working on a proposal to help fund our ambulance service. So the board will be talking about that at their next meeting. And we're also talking about our plans for repaying our line of credit, which will be due later this year. We closed out a complaint with the Centers for Medicare Disease related to the way that we give good faith estimates to patients. The board was notified about an upcoming training session that the Wyoming Hospital Association is holding for board members. And then the board went into executive session to discuss issues related to personnel, to real estate, specifically a CEO contract, and other matters that are legally protected. There was no action taken after they came out of executive session. They are scheduling a special board meeting for tomorrow. That would be the 27th, and there are 4 agenda items looking at the EMS proposal that I referenced, looking at a proposal related to the line of credit, potentially taking action on a CEO contract, and then potentially taking action on an RFP related to new auditors. So that will be a virtual meeting on the 27th at 8 o'clock. Information for joining that can always be found on our website. As always, don't hesitate to call me. Let me know if I can provide any other information for you. Thank you very much.